Hello, my name is Dr. Martin Gildea from Gildea Holistic Health and Wellness. The title of this video is Functional Nutrition Treatment Protocols. I want to balance your total body. Now I have 200 hours in functional diagnostic medicine with an attempt to get my diplomat status from the American Board of Clinical Nutritionists. In an effort to better help you with your health concerns, I've added a supplement line to my practice called Premier Research Labs, and I think they're the best out there. And you can research, if you want to, on the web at premierresearchlabs.com or prl.com. Now, my motivation for doing this is some of the startling statistics out there. Some reports show that over 100,000 deaths per year are due to adverse drug reactions. There's also 50% of this country suffering from some form of chronic illness, and that's just unconscionable. I mean, that shouldn't be. And the medical doctor's answer, more drugs. You watch the drug commercials, it's just overwhelming. Now, medications are fine on a short-term basis, but they're not a long-term solution. You cannot treat acute conditions with chronic. You cannot treat chronic conditions with acute treatment methods or acute care. Now, the medical doctors are great when it comes to saving your life in acute conditions, but they miss the ball when it comes to chronic conditions. So what's my holistic functional medicine model? My approach, here it is. Visit 1. Do a consultation where we go over your history, do a few tests, neurological tests, do some kinesiological or muscle testing. Then visit 2, have you come in, check your blood work, give you a report sheet of what we found the last visit, and some pH testing strips. Now pH is just a test to show what your body's mineral content is. And I have another video on pH, so make sure you watch that. We also have a sheet that explains how to test your pH and the rationale of why we use it and why we do it. Now, visit 3, we start you on some nutritional support based on your pH readings. Visit 4, we start you on the Nano SRT, sensitivity reduction therapy, or stress reduction therapy. And I have a video that I want you to go on a site for that to watch. It's www.nanosrt.com. Those guys explain it very well. Now, visit 5, we're going to do some validational testing using kinesiology, which is a certain protocol to test certain points on your body that relate to certain organs. And then we're also going to test you for your main complaint. There's another protocol for that. And then we're going to continue with the Nano for 6 visits. And we're going to add nutritional support based on your pH readings. And we're also going to retest any weak areas and modify that from your testing. Now, the first 2 visits could be days apart, but then after that, visits 3 to 9 are 1 week apart, and then we're going to stretch your visits out to monthly. Okay? Now, all other visits will consist of the muscle testing and the mud packs as far as the monthly visits. Mud packs are used to detoxify your body. So if you want, go on the website and hit mud pack detox, you could read about how that works. And PRL has some of the best mud, they say, for volcanoes and areas around the world that nobody else could match. And I'm also going to continue to monitor you nutritionally and address any other things such as electromagnetic fields from cell towers, because sometimes that radiation will affect, reflex to certain points and turn off those points and correspond to certain organs adversely. And then we'll also deal with any other condition that might come up along the way if you get hurt or, whatever else happens in life in general. Now, the cost per visit is as follows. Visit 1, 2, and 3 are $195 for all 3 visits. Visits 4 to how many it takes to get you better are $95 per visit. And this includes this includes the Nano, the muscle testing, and the mud pack treatment, but it excludes any recommended nutrition in your case, okay? So I usually tell people to allow for $100 to $300 per visit for the nutrition, but keep in mind, once your health concerns are met or managed, your maintenance nutritional recommendations are going to be a lot less costly per month, and that's, whatever you want to spend. Now, payment is due at the time of service, but we do offer care credit, okay, and they offer 12 months same as cash or no interest for those who qualify, and we also do offer a package deal for those who want to pay for visits up front. And for example, if you pay fee for service for those first 9 visits, it would add up to $765, excluding any of the recommended nutrition. Okay, but if you buy the first 9 visits, you could save 15% or $115, and that brings your cost down to $650. Now keep in mind, just doing the Nano alone, I charge $595 for 6 visits. So for the testing and the nutritional testing and the mud pack treatment, you're almost getting that for nothing. Now, this functional medicine model is helping those with chronic health conditions get better that medicine has no answer for. I'm extremely excited about this. I'm in a network of 400 other doctors around the country doing this, and I just can't talk enough about how great it is. So make 2013 the year you do something about your health concern. Okay, just keep doing the same thing over and over and covering up with drugs. That's not going to get you better. So watch my other videos. There's like 4 of them altogether. And then watch the Nano at www.nanosrt.com. And give us a call. Number 717-486-8189 or www.gildeachiropractic.com. Thank you very much.